Okay, so this is a TMJ mobilization. I'll do all three in one video. So we're going to have just the regular distraction, distraction with the anterior glide, and distraction with the lateral glide. The first one is just going to be straight down. So I've already told my patient about the procedure, and I have a glove. And basically this is going to involve me putting my thumb on her back molars with my index finger, supporting her mandible. And then my other arm is going to go around her head and kind of supporting it with my chest to keep her head stable as I distract the joint. So what that looks like is I'm going to come here. I'm going to say, okay, so open your mouth. I'm going to go in on the back molars with my index finger, resting on the mandible. And then what I'm going to do is I'm going to say, close down just a little bit, but don't bite me. And then I'm just going to distract straight down, like that. And a big key for that is also keeping my elbow in line with her head as well. So that would be the first one. I want to take a break in between each one of these just to make sure that she has time to swallow and things like that. So that was the first technique, and I would hold that for about 15-20 seconds. The second technique is the same thing where I distract first, but then there's an anterior glide component. This would be for limited protrusion. So what that looks like is same deal, same setup. Open your mouth for me. I'm on the back molars again, elbow in line with the head, and I'm going to go distract and then anterior glide. And that would be for the same amount of time, 15-20 seconds. So for the very last one, this is a lateral glide, and this would be treating on the far side. So you always stand on the opposite side of the pain. So that would be her right side of TMJ, and I'm going to glide towards me for this one. So this is the same setup. So I'm going to come here. I'll say, okay, open, and then you can close down, and then I'm going to distract first, and then laterally deviate, and hold that for 20 seconds, and then back. Good.